Kia ora, I'm Mana Watene, I'm a registered nurse. I'm currently on the pathway to completing my certification to become a licensed or a registered smear taker. I do take smears. In order to become a registered smear taker, I have to complete so many smears and then be assessed as well.
Cool, thank you. So what is a smear?
So a smear is a test that is carried out on a sample of cells taken from the cervix to check if there are any abnormal cells indicative of cervical cancer.
Cool. Okay, so that's the technical terms.
Yeah.
How do you do a smear?
So a smear is taken. I do have some tools here. So although this looks quite daunting, it is a speculum, and this is inserted into the vagina. There are smaller ones. This is just a bigger one that we use on bigger women. They do vary in sizes, but essentially we insert it into the vagina, which it helps open up. And there's a light that sits in here so I can see into the cervix. And at the end of the cervix, or at the end of this should be the cervix, and I insert a Cervibroom. Both items look very daunting, but they should not cause any pain. And I simply brush the tip of the cervix and take this off and put it in here, ready to be sent away.
Okay, so how often do women have to have smears?
So usually, it's usually every 3 years. It's supposed to be changing to every 5 years, but we haven't. It hasn't been confirmed yet. But so far, if your test results come back normal, it's every 3 years. If there are abnormal cells, then we usually ask you to come back in a year's time.
Cool.
To check for that. And all women between the ages of 20 to 70 who are sexually active, it should be having regular tests, and regular tests do help prevent cervical cancer.
Okay. Can I bring support people with me?
Yeah, sure, you can bring anyone. Usually that's another barrier. I don't have anyone. Can I bring someone? Of course you can bring someone, you can bring anyone. The procedure does not expose you, so the person can sit right next to you at the top of your head while the procedure is happening. You can also bring your kids. That's usually another main barrier with mamas who have young babies. I have my young kids. I encourage mamas to bring their babies. Personally, life happens, and we always find ways to occupy it. And the kids, although the kids don't see anything, they're usually quite interested in what's happening to mum.
So congratulations on your pregnancy. Can you get a smear while you're pregnant?
Yes, you can. Although it's recommended that we wait till after pregnancy, and if abnormal cells do come back, we don't usually like to start treatment unless there could be complications, but we usually don't start any treatment as well until after baby is born.
Okay. So why don't women like to get smears done?
There's various reasons, and the main reason is because that area is it's a very private area for women, usually odor. I haven't washed, I've had sex the night before, I've got my period. There's various reasons, but usually it comes down to self-esteem and confidence.
Okay. So knowing that women aren't always in a hurry to get a smear. What do you do to make them feel more comfortable?
Talk to them about the procedure. Usually, I have a conversation with them about anything just to take their mind off it. Encourage them to bring a friend. Usually having someone from their own culture or having a woman smear taker is always helpful. Usually most smear takers are women, but sometimes a doctor can do it, which makes them feel uncomfortable. Just ensure that, just speak calmly and remind them to relax. Don't push the subject. If they're not ready, they're not ready. And wear something, a sheet, cover them with a sheet. And usually I do, and I only expose up to the knee. But just having something over them and not feeling vulnerable. Yeah.
Cool, thank you. Okay, so I've had my smear, feeling good for the procedure, but then I go home and I'm a bundle of nerves. How do I get the results from my smear?
Okay, so results usually take between 3 to 5 days, and they come back to your GP, and they also come back to the smearer. And usually we ask you, or you sign a form that says how would you prefer to get your results, via text, via phone call, or would you like us to call you back into the clinic? If it's normal, usually we just we send out a letter, or your GP will send out a letter and tell you to come back in 3 years. If there's anything abnormal, we do get back to you straight away, and your tests are then referred on to be analysed further.
Oh, awesome. Thank you, Manya. Ngā mihi nui kia koe.